Pure Earth Philippines joins the rest of the world in celebrating the 10th International Lead Poisoning Prevention Week, reminding government, civil society organizations, health partners, industry, and the general public as a whole of the significant risks of lead exposure on health and the environment and the need for action. Yes, at Pure Earth Philippines, we don't just speak about this pressing issue, we actually do our part in pitching for solutions. In 2021, we partnered with the Department of Science and Technology Food and Nutrition Research Institute, or DOST FNRI, for the inclusion of blood lead level, or BLL, in the National Nutrition Survey, or ENNS. Why is this important? Let's ask our partners.
Lead is one of the common causes, or I think one of the causes of stunting. And the problem here in the Philippines on stunting is very high, no? So reaching as high as about 33% among our school-age children. So this prevalence is really, for me, an alarming prevalence, no? So when they told me about trying to look at the factors or the determinants of stunting, and that's actually more on the lead, then I said, yes, well, why not? This is worth investing because it's a new project, and if it is actually founded, then we can maybe redirect some of our policies and programs to actually include lead as one of those priorities to address stunting.
The importance of adding blood lead level survey in the National Nutrition Survey, or the ENNS, is that we would know the exact level of blood lead among these population groups, the pregnant women and the children 6 to 9 years old. So with the environmental factors that we collected on the exposure of lead, this will serve as validation to the data or to the level that we have collected.
The essence of this partnership is sharing of technical expertise, and this will also open up different opportunities for more collaborative work.
The information that will be gathered from this collaboration and project will be a start of determining the different areas that is being contaminated by lead. Hence, we could give a short or long-term measures to address such problem.
So out in the field, FNRI teams conducted a survey and collected blood samples from children ages 6 to 9.
Actually, I'm very excited and highly honored to be part of this first ever BLL survey in the Philippines. The step-by-step process is, first, we locate the targeted households based from the year 2015 PSA census. So this is randomly selected, and then from there, we're going to interview the family members in one household, and we're going to ask if there's pregnant or any 6 to 9 years old children. There will be blood extraction of 0.5 cc. The blood will be tested in our office for the blood lead level.
This initiative is in itself a win because lead is a highly toxic metal, and yet few are aware of such exposures and its negative impacts on health.
Sa pagkakaalam ko po, ang lead or tingga po ay isang uri ng tinunaw na bakal. Wala po akong idea kung saan po nakukuha ang lead.
Ay parang naririnig ko sa kanila na yun ay masama sa kalusugan, di ba? Yun lang ang pagkakaalam ko.
Hindi ko po alam yung mga lead na yun kasi hindi naman sa amin na naiituro at kaya hindi ko nalalaman.
This way, we can begin raising awareness even at the grassroots. We also tapped the services of East Avenue Medical Center National Reference Laboratory for the analysis of the blood samples collected. According to them, this is also the first time they are doing an analysis for community exposures under a national survey.
At first, we were a bit worried because we will not be able to get the usual volume of samples since we will be getting the samples from children, and generally, it's harder to extract blood from children because they are scared of needles. After the analysis, we were able to find out that from the 261 samples that we've analyzed, there were only around 67 samples that yielded concentrations of lead. greater than 2 but less than 5 microgram per deciliter. And we only had one sample that yielded a concentration greater than 5 microgram per deciliter. There's really no safe levels for lead content in the blood because even at smaller dosages, it could be quite toxic for children, especially for children.
The first phase was done in 13 areas. Thankfully, the findings so far are not that alarming. Majority of the children had blood lead levels below the detection limit of 2 micrograms per deciliter, while 202 or 26% of 775 children had detectable blood lead levels ranging from 2 to 11.16 micrograms per deciliter, and only 64 or 8% went above the US CDC action level of 3.5 micrograms per deciliter.
This small number could mean that the country's previous efforts in taking out lead are rendering results, but this cannot be considered as our national baseline yet.
The BLL survey is covering 12 more areas until the end of the year. Even with that, there are actually 92 remaining areas under the ENNS that are not covered by this pilot effort.
Now, with these current results, does this mean that we are risk-free in terms of childhood lead poisoning? The answer is no. Even at low levels of lead in blood, there can already be irreversible detrimental effects on the growing child.
On the population level, if we have more people who are exposed to lead, significant exposure to lead, it could shift the curve to the left, meaning there are more children who have lower IQs. And we do not want that. So for obvious reasons, we do not want that. And not just children, but also even in adults, those who are exposed to lead for maybe because of their jobs, they could exhibit, people who are exposed could exhibit hypertension, chronic kidney disease, which could have an impact on the health system of the country.
The children are also affected by lead exposure, and this can lead to lead poisoning. And when we say lead poisoning, this can affect the children's development as well as that of their cardiovascular, of their central nervous system, and even their kidney functions. And as we all know, children, they're the hope of the country. So if they get affected, then it's really going to be a big problem for our country.
Pure Earth and FNRI are now jointly feedbacking the results to the respective local government units and the participants themselves, as well as the Department of Health. For the survey participants, further medical consultation services are being offered through the National Poison Management and Control Center of the UP Manila Philippine General Hospital.
The other advocacy that I'm really hoping will happen over time is having lead determinations as early as the first 2 years of life. So that's something that I have advocated for quite some time already, because I still feel that the determination of lead should be part of the well child visit rather than seeing them when they're already sick, so that they don't get exposed, especially now that we know that there is really no safe level for lead. And any level can really be detrimental to the child.
So what I do really appreciate is that we are all equal. So whether if, like, say, I'm a medical doctor, I do work with our social scientists, then we have engineers, we have experts, not just here from the Philippines, but also in other countries who would come. But we would work together because we do understand that we're sharing the same kind of sentiment, and that is to ensure that communities are safe as far as exposure to this, especially heavy metals. And I think at the end of the day, whether you're from government, you're from NGO, we always have to take into consideration that we're here to really protect our environment. I think it's not just in terms of our legal obligation, but I think it's also a moral, spiritual obligation to make sure that we're bringing in and raising children in an environment that is safe for them to live in. So not just children, but everyone else for that matter.
Pure Earth is also gearing up for home-based assessments in order to pinpoint lead exposure sources right in the homes of those with detected blood lead levels. Once done, this will serve as the basis for source-specific interventions. Relevant to this, Pure Earth Philippines' recent rapid marketplace survey revealed the presence of lead in aluminum cookware, ceramics, cosmetics, toys, paints, and spices ranging from 1 to 41,800 parts per million based on X-ray fluorescence readings. We are yet to find out if these will be consistent with what we'll find in the homes of affected children.
With the strong support of government institutions in this breakthrough effort, from survey to analysis to feedbacking to source identification and intervention, we are all together paving the way in not just saying no to lead poisoning, but clearly in protecting the Filipino children's potential too.
We hope that as a way forward, there will be a lead monitoring and surveillance system in place in the Philippines.
Early detection is early intervention. That is the goal, and a significant contribution we can make by sharing it to other nations so that no child would have to live with the devastating effects of lead and be robbed of his or her future.